On this Monday night, new rules at Canada's border. Who's now banned and why Americans are still allowed.
Now is the time to take this particular step.
As the COVID-19 crisis escalates, the message to Canadian travelers.
If you're abroad, it's time for you to come home.
Plus, the markets tank again. And from self-isolation to testing for the new coronavirus, we get answers from the experts.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. After weeks of growing pressure and with cases rising rapidly, the Canadian government is taking steps to secure the border. Ottawa is barring most foreigners except Americans from entering Canada, and only 4 Canadian airports will be allowed to accept international flights.
And now is the time to take this particular step. It is a significant step. It is a step that we take in exceptional circumstances, but it is the right step to be taking today.
As part of the new restrictions, the Prime Minister says any Canadians who are abroad and have COVID-19 symptoms will not be allowed to board flights home. He's urging people to do their part to help slow the spread.
Let me be clear. If you're abroad, it's time for you to come home. If you've just arrived, you must self-isolate for 14 days. And finally, all Canadians, as much as possible, should stay home.
The situation in Canada is changing quickly. Here's what we can tell you. As of right now, there are more than 410 cases across the country. BC, Ontario, and Quebec all recorded double-digit increases today. And the number of deaths has jumped from 1 to 4 after 3 more people died in BC. They're all linked to a North Vancouver care home. The situation in the U.S. and Europe is escalating. We'll get to that in just a moment. But first, what's happening here at home as the government ramps up its response to the outbreak. Mike Armstrong has tonight's top story.
Stepping out of Rideau Cottage, where he's in self-isolation with his family, the Prime Minister basically closed the country to most of the world. Canadians will still be allowed to return home, citizens and permanent residents, but starting Wednesday, Canada will be denying entry to most foreign nationals. There are exceptions for people like airline crews and diplomats, but also one very big group, U.S. citizens. Despite an increase in cases south of the border, the Prime Minister isn't cutting off access to Americans for now.
We recognize that the level of integration of our two economies and the coordination that we've had over the past while puts the U.S. in a separate category from the rest of the world. But we will continue to coordinate with the U.S. We will continue to examine next steps and measures that must be taken.
Now, getting on planes to come home to Canada will also get tougher. Airlines are being ordered to refuse access to anyone with symptoms, things like a cough or a fever.
Any passenger, regardless of citizenship, with possible COVID-19 symptoms will not be allowed to board flights to Canada.
There are changes coming to where planes arrive back in Canada. Most international flights are going to be funneled to 4 airports: Montreal, Toronto, Calgary, and Vancouver. There are exceptions. Flights from the U.S., Mexico, and the Caribbean are not affected, but again, with that disclaimer, for now. Ottawa is making it very clear things could get even tighter at any time.
Well, good morning, everyone.
Now, Ottawa's reaction at the border comes after some criticism. There's been pressure from several premiers that the federal government wasn't taking the threat from international travelers seriously enough. The frustration was so strong in Quebec that the city of Montreal sent public health officials to the airport to remind travelers they should self-isolate for 14 days. Now, there is new increased screening at airports. International travelers are having to answer questions on CBSA kiosk touchscreens. They have to say whether they have symptoms and acknowledge they know they have to self-isolate for 2 weeks. For the first time, there are new extra border guards at airports looking for travelers with symptoms. That's something critics have been calling for days. Border guards are also being given masks to hand out when they're concerned with someone's health. Robin?
Mike Armstrong in Ottawa. Thanks, Mike. Canada's Chief Medical Health Officer says the new travel restrictions are needed to try to slow the spread of COVID-19. But one big question, why are Americans exempt? Abigail Bimman looks at that angle tonight.
Travelers flow through Toronto's Pearson Airport, one of 4 that will remain open to international flights when new restrictions come into force.
You got to do proper screening to make sure everything's straight, so you don't want to keep sending it back and forth.
And for now, flights between Canada and the U.S. are not restricted.
We have been collaborating very closely with the United States.
But with such a high number of COVID-19 cases south of the border, British Columbia, for one, wants a tougher ban. Washington State has seen the most deaths.
It's our strong message that visitors from the United States not come to British Columbia. Don't come at this moment. That is the wrong thing to do.
That Canada-US border in particular is a lifeline for both of our countries. This is a situation which we are reviewing constantly in real time.
With a volatile American president who may not take kindly to a shutdown, Ottawa says Canadian leaders made the decision on their own, and it may change. Ministers point to the food supply chain as a critical thing to protect. Truck drivers and others who rely on cross-border life are also exempt from the 14-day requirement to self-isolate when they return.
If we put in measures for mandatory self-isolation, as many people have looked for, there would need to be enforcement measures around that, both by public health and by public safety.
No plans to do that yet. Abigail Bimman, Global News, Ottawa.
Nearly 7 million people in the San Francisco Bay Area are in lockdown. U.S. President Donald Trump did say he would consider a federal initiative to lock down so-called hotspots. Let's bring in our Washington Bureau Chief Jackson Prosco. So, Jackson, might this happen in other areas?
Well, Robin, the White House is being cagey about what exactly might happen in the coming weeks and months when it comes to lockdowns or travel restrictions. One question that came up today, of course, was the border with Canada after Prime Minister Trudeau's announcement. In that case, the president hinted that they have, in fact, considered a lockdown of the Canadian border, but he says it's not something that's on the table at this exact moment. He seemed to be hinting that the two countries are simply too closely linked when it comes to business and trade. Take a listen.
We think about it. If we don't have to do it, that'll be good. We have very strong emergency powers when it comes to something like this, both on the southern and the northern borders. And we are talking about different things, but we'll see. Right now, we have not decided to do that.
And Jackson, let's talk about those concerning comments about ventilators that Trump made today.
Yeah, this really kind of gives you a sense of how fractured the American response is. There was a conference call between the president and all of the state governors today. And on that call, the president told the governors to go it alone, try and find respirators and other medical equipment on their own instead of waiting for a federal response. He added the federal government would have their backs if needed. But that flies in the face of what we're hearing from local officials. New York's governor today, for example, called on the federal government and the Army Corps of Engineers to start building hospitals now. Trump says he'll consider it. And Robin, one more sense of the patchwork of regulations. You talked about that lockdown in San Francisco, for example. But generally speaking, the White House is only recommending social distancing as a recommendation, saying no groups of more than 10 people, avoid bars and avoid non-essential travel. Those are recommendations, not an order at this point.
Jackson Prosco in Washington. Despite the U.S. Federal Reserve slashing the key interest rate, the markets were still volatile today. The week began with another huge plunge. Trading was temporarily halted this morning on the Toronto and New York stock exchanges, the third time that has happened in 8 days. The TSX closed down more than 1,300 points today, a nearly 10% drop before ending the day at 12,360 points. The Dow Jones plummeted 3,000 points to close at just over 20,000 points. That's a 3-year low. The situation is particularly perilous in Italy, where for the second day in a row, more than 300 people died in a 24-hour span. The country has confirmed nearly 28,000 cases of COVID-19. Spain is quickly becoming the next global hotspot. More than 300 people have died in that country, with more than 9,400 people infected. Europe is now the epicenter of this pandemic, and the governments there are tightening border access. The European Union is planning to restrict all non-essential travel for foreigners to its 27 member states, although that ban does not apply to visitors from the UK. Some European countries have already taken their own stringent steps, barring or limiting entry to non-citizens. As our Europe Bureau Chief Crystal Goomansingh reports, countries like France are restricting the movements of its own people, while the UK is telling Brits to stop all non-essential contact.
A plea to UK citizens: do your part and stay home.
It looks as though we're now approaching the fast growth part of the upward curve, and without drastic action, cases could double every 5 or 6 days.
Legislation is not being used. Instead, the idea is that people will comply because they see how Europe is struggling with COVID-19. Thousands have died in Italy. Morgues and funeral homes are overwhelmed. At just one cemetery in the Lombardy region, there were 12 funerals in a 6-hour period. Spain is reestablishing land borders as it fights a rise in infections. Social distancing is key, but the World Health Organization wants more testing.
You cannot fight a fire blindfolded. And we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
Crystal Goomansingh, Global News, London.
Every year, more than 300,000 Canadians head south for the winter. Many of those so-called snowbirds are now scrambling to get back. Ross Lord reports.
As Cameron Francis arrives home, health inspectors remind him of new rules that he needs to self-isolate for 14 days, something he'd rather do in this corner of the continent, Halifax, instead of his adopted home in Los Angeles.
I was really scared that I might be stuck in the United States and that the pandemic might be much more serious and that I'd be stuck there and unable to get to my parents and my family, so I came back now.
Have I traveled out of the country?
Yeah, outside of Canada.
In several provinces, these inspectors are being dispatched by provincial governments, tired of waiting for the federal government to supply them. But Francis suggests Canada is ahead of the U.S. in taking measures to limit the spread of the virus.
I've only seen information in Canada. In Los Angeles, there's very little.
There are similar scenes all over Canada, along with foreign nationals leaving the country. For many passengers, there's less frustration than there is a sense of relief that they made it home.
You know, I'm fine. We're all fine. But we just wanted to come back into our own country. And if that we were to get sick or something were to happen, we'd be here.
Well, it has been a bit of an inconvenience, but, you know, I understand, and these things can't be helped. And you have to do what you can to prevent it from spreading.
Like everyone else, air travelers hope doing their part to fight the virus will make a difference. Ross Lord, Global News, Halifax Stanfield International Airport.
Classes canceled during the COVID-19 pandemic. Coming up, both parents and students are in a bind. More than 420 people have tested positive in Canada for COVID-19. Here's a breakdown of where things are at. Ontario confirmed 32 new cases today, bringing the total to 177. There are 103 cases in BC. In Alberta, there are now 74 cases. 18 new ones were just announced, and 50 in Quebec. There are a total of 28 cases spread across 6 other provinces. Parents across most of Canada are now scrambling to find alternate arrangements for their children. Nearly every province and territory is closing schools and daycares. Alberta and Saskatchewan say they likely won't reopen until the fall. Heather Yerkes-West looks at why the extended break is necessary.
I mean, it says every grade 12 will graduate.
It wasn't the news 18-year-old Macy Fields had hoped for.
Pretty much instantly started crying. It was just such this scary thought to think that school is just canceled for the rest of the year.
As a grade 12 student, canceled classes in Alberta means Fields' high school days are suddenly done, and graduation plans are now up in the air.
Time is running out to flatten the curve. That's why today we are announcing that effective immediately, we are suspending all in-school class instruction throughout the province.
Every student will receive a final grade based on their current grade, and students will progress to their next grade level.
Across Saskatchewan, students are now abruptly ending their school years as well. Daycares are closing too. The longer-term shutdown coming in contrast to provinces like Ontario, where, for the most part, classes are suspended for just a few weeks.
I'll take my advice off the Chief Medical Officer. If he feels that is necessary, then we'll follow that advice. Right now, we've closed them till April the 6th.
Infectious disease experts say parents should not bet on schools and daycares reopening anytime soon.
2.5 weeks from now, 3 weeks from now, when everything may be ramping up again, I think we'll see that we're really in the thick of it. And my guess is that those 2-week bans are likely to be extended.
For parents unable to work from home, the scramble to find childcare is on. Quebec officials are promising to provide 60,000 daycare spaces for those who provide essential services. But elsewhere, most parents are on their own. Back in Calgary, Fields knows the demand for babysitters now will be great. And with school out, she's available to lend a hand. Heather, Urix West Global News, Calgary.
Up next, experts answer your questions about the new coronavirus. There's so much to absorb about this new coronavirus, about how to cope and how you can help flatten the curve and slow the spread. Many of you have sent in your questions, and our Jeff Semple is trying to answer them by going to the experts. Jeff, what are the biggest concerns from our viewers?
Well, Robin, viewers have been emailing in their coronavirus questions almost by the minute. And one of the most common COVID-19 concerns, take a look at this viewer email. Should snowbirds come home? More than 300,000 Canadians head south for the winter every year and are now wondering what to do. Well, Prime Minister Justin Trudeau was unequivocal. It's time to come home, and medical experts agree.
We've seen a lot of unprecedented things happening, such as border closures, and I don't think those are done.
The only potential hiccups in getting home is that as of Wednesday, only 4 major airports in Canada will be receiving international passengers. And if you arrive at the border showing symptoms of COVID-19, you'll be denied entry.
Oh my goodness. If we start coughing when you get there, like, what do you do?
Now, thus far, the government has been short on details.
There will be some assistance there from the consular point of view and financial assistance.
Jeff, another concern is the testing that's being done for COVID-19. Here's one viewer's question on that.
My name is Carol Patterson. I'm from Victoria, BC. My concern is that there are people coming back from traveling who won't be tested, who could then be going back to work and childcare because I run a daycare, and then infecting other people.
Well, right now, the answer to the question, who gets tested for COVID-19, partly depends on the province you live in. Anyone showing symptoms who has traveled abroad recently has been receiving the test, but increasingly officials in British Columbia and here in Ontario are focusing less on travel history and more on the severity of symptoms.
Because we might need to avoid testing people who are not sick in order to reduce crowding in these regional test centers or crowding in hospitals.
Anyone who arrives from abroad is being asked to self-isolate for 14 days. Here's a question from a viewer who just arrived back in Canada from California.
I'm Debbie. I'm from New Westminster, BC. How will we know when is the appropriate time to seek somebody from the health department?
In other words, if you've been told to self-isolate at home and you develop symptoms, when should you seek medical attention?
Well, people are having fevers day after day that are not resolving. If your cough is getting worse, if you're more and more short of breath, if you're feeling extremely weak, like you're having a hard time getting out of bed, those are all symptoms that are worrisome.
But everyone else, especially younger, healthier people who develop mild symptoms, are being asked not to go to the doctor, but to stay home, to self-isolate, stay away from others for 14 days and focus on getting better. And in the vast majority of cases, Robin, that's exactly what happens.
Still ahead, Canada looks beyond our borders for lessons on flattening the curve. Here's one way to pass the time during the quarantine in Spain: exercise. A fitness instructor led a pop-up workout from a rooftop.
And it came back positive. Yeah, and it sucks.
That's actor Idris Elba confirming he has COVID-19. He says he had no symptoms but was tested after realizing he was exposed. Elba was recently at an event in London with Sophie Gregoire Trudeau, who also tested positive for the virus. The spread of COVID-19 has followed a predictable pattern. First a case or two, then some more, and suddenly a spike, which has led to the pandemic in more than 100 countries. Canada is now seeing a sharp rise, but there's still time to bend the curve back down. Eric Sorensen explains.
Canada is taking dramatic steps because the spread of the virus is dramatic and is learning from the experience of other countries that were inundated sooner. Measuring the number of cases day after day tracks the progress of COVID-19. For example, a steady increase, 10 new cases one day, 10 more the next, and so on, would show a straight line. But real life isn't like that. In simple terms, things are getting worse when the arc bends upwards. 10 new cases one day, 30 the next, then 60, and so on. But say the rate is 5 new cases, then 10, then holds at 10 new ones, and back to 5. There are more new total cases every day, but the rate is slowing. The curve starts to bend downward. Good news.
The days, weeks, and months ahead will be a test of our resolve, a test of our trust in science, and a test of solidarity.
China was the first to confront the outbreak with a massive surge in cases before shutting down Hubei province. The virus spread. South Korea was caught by surprise, but aggressively tested and saw results. Italy was slower, and it's still in trouble. Since mid-February, South Korea has managed to flatten the curve of new cases over time. That's the model for all countries. In Italy, cases began later, but soon surged, far surpassing South Korea. Canada has fewer cases, and the aim is to keep it that way. But right now, the rate is rising. On February 26th, Canada reported 12 cases. A week later, 34, and then 118. That was last Wednesday. And now, day by day, rising numbers to 341 on Sunday and climbing. That's why government, industry, and Canadians generally are rapidly changing behavior to flatten the curve. Eric Sorensen, Global News, Toronto.
And that is Global National for this Monday. I'm Robin Gill. Thank you for watching. Good night.